English is extremely difficult, but I am here trying to make it a little bit easier for you, or at least to make your English practice a little bit easier and to help you to be more consistent. So that's what we're doing, 5 minutes of daily British English listening practice. The topic today is the UK's National Health Service, otherwise known as the NHS, the NHS, National Health Service. Now that is the UK's free health service. So hospitals and ambulances, paramedics, all of that. And your GP, so your GP, the letters GP stand for General Practitioner. So when you have some problem wrong with you that is not urgent and you want a doctor to look at it, then you can book an appointment at the GP. Not if you have an emergency, that is when you need to call 999. So that is our emergency number in the UK. So like in the US, it's 911, and that's very kind of stereotypical. In the UK, it is 999. Now, the NHS, I guess, it's not a controversial topic in itself, but I think it can be when you start to talk about the politics, because there have been rumours or there have been people considering or talking about the idea of privatising the NHS. So basically giving this free service that is run and owned and managed by the government to a private company. Now, I don't really know about the positives and negatives of that, so I'm not going to talk about that. I'm just going to talk about my experience with the NHS, because it is brilliant, it is fantastic, but it definitely has a lot of problems. And it's not the NHS's fault that they have problems. It's because they have a very big lack of funding. So they don't have enough money, basically, and they are overrun. So basically, there are too many people that need help and not enough doctors to help them. Now, I know some people that work in the NHS, and I know some people that have had bad experiences. And for example, I know a paramedic. Well, I think they are a paramedic now, but they studied paramedicine at university, and they were saying that, so they all do 12-hour shifts, which is pretty crazy, and that's very, very common in the doctor medical industry. So they do 12-hour shifts, and he was saying that because the hospitals are so overrun, basically there's not enough room for the patients. So the paramedics go and pick up a patient that needs care in the hospital, and they have to wait outside of the hospital with the patient in the van whilst they are caring for them in the van, waiting for there to be enough room actually inside the hospital. Now, I don't know if that is still the case. I think that was maybe kind of a unique time period or a very busy time period, or maybe in the summer when it is very, very busy in Cornwall. But that's pretty terrible, isn't it? You don't want to be spending most of a 12-hour shift just sat outside of a hospital caring for someone that should be inside of the hospital. But that's a pretty unique situation. I've always had quite a good experience with the NHS. It's just everything's very slow. It takes a long time for those reasons that I have discussed. Generally, if something is very, very wrong with you, if it is a very serious incident, life-threatening, then everything will be pretty quick and they will save your life, and it's great. But if you have a minor problem, if you have something that's not urgent, that's not life-threatening, you're going to be waiting a while. and whether that is for an ambulance to arrive or whether that's an appointment with a physiotherapist, that can take months. So in those situations, you are better off either fixing it yourself, hoping it doesn't get worse, or forking out the money, so unwillingly taking out the money to spend on a private service. Do you guys have something similar in your country to the UK's NHS? What is healthcare like in your country? Let me know in the comments, and I will see you guys in the next video.